Hi, I'm Ray Villas. I'm an exercise and sports science major here at Nova Southeastern University, and I'll be giving a brief overview of the female athlete triad. Exercise and physical activity are a critical part of a healthy lifestyle. Unfortunately, there can be some drawbacks for female athletes who push themselves too hard. Professor Barbara Drinkwater initially brought this issue up in 1996, and in an interview in 2018, she stated, I would say I was angry, perhaps even mad as hell, when I would see coaches requiring female athletes to do things that might have lifelong consequences, but they were more worried about winning than the well-being of the athlete. We had kids dying. The female athlete triad is caused by three major factors: low energy availability, or LEA, and that is with or without an eating disorder, menstrual dysfunction, and low bone mineral density. Low energy availability, or LEA, is typically associated with an eating disorder, such as anorexia nervosa and bulimia nervosa. These are commonly observed in sports that require balance, flexibility, and mastery of the body, such as gymnastics, figure skating, and dance. However, LEA can also be caused by an athlete's lack of knowledge of the amount of calories needed for their particular sports training. LEA can disrupt normal secretion of the gonadotropin releasing hormone in the hypothalamus, which leads to a decrease of luteinizing hormone and follicle stimulating hormone secretion from the pituitary gland, and results in a sensation of ovulation and the development of a menstrual dysfunction, which is also known as amenorrhea. There are two forms of amenorrhea. The primary form of amenorrhea is a delayed onset of a menstrual cycle in a female athlete, and this usually occurs, they usually don't get their first menstrual cycle till around the age of 15. A secondary amenorrhea is when an athlete who has had regular menstrual cycles for a few years all of a sudden stops getting a menstrual cycle. And then oligomenorrhea is the most common form of menstrual dysfunction seen in female athletes. And this occurs when the athlete's menstrual cycle goes from a typical 28-day cycle to a 35 or greater day cycle. Low bone mineral density, or osteoporosis, are significant concerns associated with the female athlete triad. Replacement estrogen therapy in the past has failed to restore the bone mass fully. So efforts to increase bone density through hormone replacement therapy and vitamin supplements have been tried in the past. And it is thought that a combination of energy deficiency, LEA, and estrogen deficiency from the amenorrhea is more damaging to bone health than either of those issues alone. In order to treat the female athlete triad, we must first be able to identify female athletes who are in danger of having the female athlete triad. The Female Athlete Triad Coalition was formed in 2002, and they developed a cumulative risk assessment tool to better identify those athletes who are at a greater risk of developing the female athlete triad. Once the athlete develops the female athlete triad, managing it is challenging and necessitates a comprehensive approach due to its intrinsic nature. The team required to treat the athlete includes your physician, a dietitian, physical therapist, athletic trainers, friends, family, coaches, a psychologist, and most importantly, you need the athlete at the center of all of this. A thorough physical examination conducted by their primary care physician is vital to identifying all organs and systems that could be affected by the female athlete triad related conditions. The treatment and recovery process for the female athlete triad is long, and it comes in different stages. So the first stage of energy status, the athlete will see an increase within a matter of days, as long as they start keeping their calorie intake at the normal level for a normal athlete. Once their energy level starts to increase, after a few months, they should start to see their menstrual cycle start to become more regular again. And the last phase that will come about will be the recovery of bone mineral density. And this could take up to a few years to return to normal. There are many tools available to female athletes to help make sure that they are not at risk at developing the female athlete triad, such as tracking their calorie intake, exercise habits, and menstrual cycles. And this will help ensure that they remain healthy and in peak condition for the training of their sport. So in conclusion, the female athlete triad is a serious health condition that affects female athletes who overexert themselves. Early diagnosis and treatment are essential to preventing lifelong consequences associated with this condition. Treatment is a long process that requires a multiple disciplinary approach involving various healthcare professionals, and a thorough physical examination is essential to identifying all affected organs and systems. Coaches and other professionals must prioritize the well-being of female athletes over winning.